Good afternoon, everyone, and welcome. My name is Elisa Slodzinska, and I work for the City of Chicago Department of Business Affairs and Consumer Protection. Welcome to today's webinar covering Chicago's new mask mandate for businesses. This webinar will be an overview of the mandate that requires everyone aged 2 or older, regardless of vaccination status, to wear a mask in public indoor settings effective today, Friday, August 20th. For those who are seeking business licensing assistance, we strongly encourage the processing of licenses and permits online. Business licenses can be applied for or renewed online at chicagobusinessdirect.org. Or for licensing questions, you can call 312-74-GO-BIZ. I will post that information in the chat box. And we encourage attendees to ask questions. Please use the chat box and send your questions to all panelists. There will be a Q&A at the end of the presentation. Also, this webinar is being recorded and will be available on our YouTube channel by visiting youtube.com/Chicago BACP. Thank you in advance for your continued efforts to keep your customers and employees safe and for following this new masking requirement. And now I would like to introduce my colleague, Miguel Campos with BACP. Welcome, Miguel.
Thank you, Elisa. My name is Miguel Campos. I'm a supervisor with the Department of Business Affairs and Consumer Protection, in particular with our Business Compliance and Enforcement Unit. Prior to beginning, I would like to share some information. Some of it may be repetitive from what we just heard from Elisa. So as stated, the webinar will be recorded and be made available on the BACP YouTube page. In addition to the site that she listed, you may also access our YouTube page by going to chicago.gov/business workshops, which is the same website you all use to register for this webinar. As stated at the beginning, we would like to encourage all of you to ask as many questions as you may have. Questions can be typed into the chat panel for the webinar. Questions may also be submitted via email to bacpoutreach@cityofchicago.org, which is the email address that will be on the bottom of each slide of this presentation. BACP wants to extend a thank you to all of our businesses throughout the city for your dedication and sacrifice over the past year and a half. We realize that it has been an extremely challenging time with ever-changing regulations, and we are incredibly thankful to our business community for stepping up to keep your customers and employees safe throughout the ongoing pandemic. This will be the agenda for today's webinar. We will start with a quick overview of our current health metrics. We will dive into the new mask mandate. We'll cover how to get vaccinated, and then we will have a question and answer session at the end. We will start with the current status of our travel advisory. It is updated every Tuesday, so this is as of August 17th, 2021. The advisory added 8 states this past Tuesday. We now sit at 39 states and 3 territories, which sit at a status of they're averaging 15 daily cases per 1,000 or more on a daily basis. As a reminder, unvaccinated travelers should avoid non-essential travel. Returning travelers who live or work in Chicago or visitors to Chicago who have traveled domestically are not required to quarantine if they are asymptomatic and fully vaccinated. If you are not vaccinated and traveling from a state with 15 or more average daily cases per 1,000 population, which on this map would be anything with a color of orange, you should receive a negative COVID-19 test no earlier than 72 hours prior to arrival, and have proof of negative results or plan to quarantine for 10 days upon arrival to the city. I'll quickly cover over health metrics. So the reason we have instituted a masking mandate is because our the number of COVID-19 cases that are diagnosed per day has creeped into this high risk level here. So we are currently averaging 419 cases a day. This is a 7-day rolling daily average. Our goal is to be in the 200 to 399 moderate risk category. In addition to that, our COVID-19 test positivity currently sits at 4.3%. It is increasing, however, but that does place us in the lower risk category. Hospital beds, so non-ICU hospital beds being occupied by COVID patients are currently at 193, which again places us in the lower risk category. And then ICU beds occupied by COVID patients, we are currently at 62. Again, that number is currently increasing, but that also places us in a lower risk. I'll cover in detail later on why the hospitalization rights are important as the city might in the future consider instituting more restrictions. Chicago COVID-19 data is updated every weekday at chi.gov/COVID-. Our case count for the full pandemic, again, we're crossing the average of 400 cases a day. While this is significantly lower than our highest peak at the end of last year, which would be here when we were averaging around 2,500 cases a day, we do want that 400 cases a day number to be lowered. Breakthrough, so 99.97% of vaccinated Chicagoans have not been diagnosed with COVID-19 after vaccination. Our current average for hospitalizations is at 18 per day, and 99.99% of vaccinated Chicagoans have not been hospitalized with COVID-19 after vaccination. So now we'll get into the mask mandate. So our new mandate, as our case count moves into the higher transmission risk, masks are now required as of today in indoor public settings in Chicago for all persons aged 2 and over. This mandate will remain in place while our case count remains over 400 cases a day. So again, face coverings are required for everyone effective today. As it has been throughout the pandemic, the latest and up-to-date overview of our COVID-19 regulations are posted at chicago.gov/reopening. You can view and download the Phase 5 guidance, any Phase 5 guidance graphics, as well as mask posters and signage in both English and Spanish at chicago.gov/reopening. So again, effective today, August 20th, face coverings must be worn in all indoor public settings, regardless of vaccination status. There are some exceptions built into the new health order, and I'll cover those right here. So if your customers or yourself, if you're actively eating or drinking at a restaurant, bar, or similar eating establishment while stationary, we do ask that customers be fully masked when they are engaging with restaurant staff or, for example, a server. Under certain circumstances where personal service activities require the removal of a mask, that would also be allowed. Examples of these would be a beard shave or a facial. Again, this is removal by the customer and not the employee. Employees and settings not open to the general public. If employees are static and maintaining at least 6 feet of social distancing, for example, in an office setting where cubicles are placed more than 6 feet apart, your employees can remove their mask while sitting at their desk. We do ask while they're walking around through shared or common areas such as hallways, restrooms, break rooms, reception rooms, etc., that employees be fully masked. All businesses and venues should support social distancing to the extent possible, especially in indoor settings. Businesses and venues should apply best practices in managing distancing at such places such as concessions or counters, public restrooms, or lines or queuing of your customers. So again, the health mandate applies for public indoor settings. So I'll take a couple of minutes to differentiate between the two. So common outdoor settings are open air stadiums, for example, Wrigley Field, Guaranteed Rate Field, Soldier Field. Masks do not need to be worn in open air stadiums. Parks, parking lots, sidewalk cafes, outdoor patios, and expanded outdoor dining areas. If you are interested in applying for a sidewalk cafe, a permanent outdoor patio liquor license, or an expanded outdoor dining area, you may still do so by going to chicago.gov/BACP. Outdoor settings include rooftops, retractable roofs, outdoor tents that are at least 50% open, igloos and other one-party enclosures, and any indoor space where 50% or more of a wall can be removed via the opening of windows, doors, or panels, provided that dining tables are within 8 feet of such openings. As such, for some of you, this may mean that you have a hybrid or combo situation going on at your place of business, where some people that are not seated within 8 feet of such openings do not have to wear a mask, while people within the opening would not have to. Common indoor settings, commercial and residential buildings. Again, masks must be worn in common or shared areas. This includes residential buildings. So for example, hallway in a condo building, elevators, laundry rooms, indoor fitness rooms, etc. Hotels are another common example of an indoor setting. Recreation centers, bowling centers, arcade places, museums, gym and fitness centers. This includes both public and private gyms. So this would cover a gym in a residential condo building. Personal services, retailers are generally indoors, retail stores, performance venues, and movie theaters. This includes indoor performances. So it includes the live musical acts and other types of entertainment. So any indoor performance would require masking at all times by attendees. If there is a food or drink component to your business, then customers can remove their mask only while they are actively eating or drinking. Important distinctions to point out are that face coverings for actors or performers are not required during a show, but should be worn during offstage activities. For example, if they're on breaks or they're milling around backstage. Hospitals are another common outdoor setting. As a reminder, public transportation, which includes taxis, ride-hail, and liveries, you must wear a mask in those instances as well. We have been receiving questions regarding event venues. So event venues are considered public spaces, even if the events you're holding are private. Common examples of these are weddings, birthday celebrations, work-related meetings, or outings. The reason they're considered public spaces are because members of multiple households attend the event, and events are held at commercial licensed locations. So these are common questions that we're getting regarding event venues. So if it is in an indoor setting, you must ensure that your employees and all attendees are wearing a mask if they're age 2 or over. We have some variations of locations that could be indoor or outdoor at the same time. So we've covered bars and restaurants. There are outdoor components, which would include an outdoor patio, an expanded outdoor dining area, a terrace, a rooftop, etc. Health and fitness centers. Some of you have held classes in outdoor settings. If a class is being held in outdoor settings, then there would be no mask requirement, as opposed to having a class in an indoor setting. Ticketed spectator events, places of worship. Some of you have expanded services to be held in outdoor areas, for example, parks. So again, if your ceremony, religious ceremony is being held in an outdoor setting, masks would not have to be worn. Meetings, conferences, and conventions could be a combination of both indoor and outdoor. Festivals and general admission spectator events, and then flea market and farmers markets. I'd like to touch on the city's guidance for large-scale events. So large-scale events are still being allowed to operate at full capacity. However, the city strongly recommends that event organizers implement additional health measures when holding large-scale events. Some of these recommendations include requiring attendees to be fully vaccinated against COVID-19 or have a negative COVID-19 test no more than 72 hours prior to attending the event. For all gated or ticketed events and for events with designated entry checkpoints, we recommend that you check that documentation of vaccination or negative test results at the entry point itself. As a reminder, an individual is considered to be fully vaccinated 2 weeks after their second dose of a 2-dose series vaccine, such as Pfizer or Moderna, or 2 weeks after a single dose vaccine, for example, Johnson & Johnson. We'll get into the actual business requirements and what the health mandate means to those of you attending today. So businesses are required to ensure that customers and employees are adhering to the new face covering mandate. Businesses are required to notify their customers prior to entry about the new face covering mandate. You must post signage that says masks are required for all customers, regardless of vaccination status, at the entrance to your establishment, and in a single or more or multiple conspicuous locations inside your establishment. The city has provided signage for you guys if you choose to utilize it. Signage is available for download by visiting chicago.gov/reopening, clicking on the resources tab from the drop-down menu, and clicking on communication resources. At the moment, the signage is available in both English and Spanish. This is suggested guidance for business. This is repetitive of something I mentioned earlier today. We are asking or encouraging you to support social distancing to the extent possible for customers, in particular at indoor settings. Masking remains optional in outdoor settings. Masking is recommended for unvaccinated individuals in crowded outdoor settings. Masks remain mandatory on public transportation, healthcare settings, schools, and correctional and congregate settings. This has been the case for several months now. I'll cover items that are not changing. So that new health order is not updating guidance for the following. We are not instituting capacity restrictions. This includes items such as limit on party sizes or table sizes. We are not instituting social distancing requirements as in the past. There are no limits on the hours of operation, regardless of the type of business that you are, whether you're considered essential or non-essential. There is no curfew order. At the beginning of the presentation, when I was covering the health metrics, I mentioned the potential for further restrictions. If our cases rise over 800 a day, or double what we are averaging now, or if our hospitalization stats rise in an untenable way, the city's health commissioner may institute further restrictions. The current mask requirement can become a suggestion if we are consistently under 400 cases a day, and it will be removed completely if we fall under the average of 200 cases a day. I'll cover vaccines. COVID-19 vaccines are safe, effective, and widely available across Illinois. Everyone aged 12 and older should be vaccinated against COVID-19 as soon as possible to keep from getting and or spreading COVID-19. We do ask if you are sick with COVID-19 or think you might have COVID-19 to please stay at home and avoid public spaces except to get medical care. Most Chicagoans who are receiving or have received their COVID-19 vaccines obtained that from their pharmacies, for example, Walgreens, Mariano's, Walmart, Joe Osco, Costco, etc. Walk-ins or appointments are widely available. You should contact individual provider for details. Some of you have chosen or have the option to go to your healthcare provider to obtain a vaccine. The city also has a program that we have called Protect Chicago at Home. You can register online at chicago.gov@home to have someone from the health department or a volunteer go to your home and vaccinate you at home. You may also call our vaccine hotline at 312-746-4835, or go to socdoc.com/vaccine to find available locations where vaccines might be provided near you. Again, just to reiterate the importance, your healthcare provider, pharmacy, or socdoc.com, which has streamlined Chicago access to COVID-19 vaccines. Chicago.gov/vaccine finder or 312-746-4835. We have listed the websites I mentioned during the presentation in the below slide. I will leave this up as we start our question and answer session. We will now try our best to answer any questions you may have. Again, questions may also be submitted in writing via email to bacpoutreach@cityofchicago.org. In the case that we need to collaborate with other partner agencies, we will request that you submit your question at the email address I provided, and we will get back to you as soon as we can. There will be some scenarios where we will have to touch base with the Illinois Department of Public Health or the Chicago Department of Public Health to give you an accurate and appropriate answer. Before getting to your questions, I would like to remind all attendees that many government and community partners are offering financial relief and support services. You may visit chicago.gov/NBDC to find one near you by clicking on the Financial Resources tab. With that being said, I will now ask Elisa to go through the chat box and begin answering questions that you guys have posed.
Great, thank you so much, Miguel. First question that we have is, for offices close to the public that is fully vaccinated, what is the masking recommendation for employees as they circulate the office?
So our recommendation or mandate is that if they're circulating the office and they're using common or shared spaces, they should be fully masked. Again, the exception or exemption in the mandate is if you are seated at your desk, you're static, and your individual workstation is properly socially distanced at a distance of 6 feet or higher. So while your employees, even if you're not open to the public, are moving around common or shared spaces, they should be masked.
And for those asking for the health metrics data, as Miguel has pointed out, the website for that is chi.gov/COVID-. It is the second website shown right now on the PowerPoint, and it is updated weekdays daily.
The last website I have listed on this slide is where you can find a copy of the health order and all previous health orders issued as a result of the COVID-19 pandemic.
For visitors to Chicago, is the quarantine a self-quarantine or is it mandated?
It is a suggested self-quarantine.
Is it a violation of the city's mandate talking about indoor and common elements if in an office someone is choosing not to wear a mask in those common areas?
Yes, there are exceptions on there if someone has a medical reason for not wearing a mask. But yeah, if someone's just without a medical rationale choosing to not wear a mask, it would be a violation of Health Order 2021-01, which mandates the mask wearing.
What is required from individuals who work in the hospitality industry that are met with resistance from individuals who refuse to wear masks indoors? If the place of business has signage posted throughout the building and individuals refuse to adhere to the mandate, is the business subject to be fined
Yes, you're unfortunately your place of business would be subject to a fine. As a private entity, you have the right to refuse service to anyone who refuses to follow your instructions or orders. Speaking of enforcement, our enforcement approach is that of educational at first. This is the reason we held a webinar yesterday and are having one today. We do have a progressive enforcement approach. We would like to start with written warnings before moving on to citations. However, please note that in egregious violations or egregious situations, the city does have the authority to issue citations and including a one-day closure or longer or permanent closure. Enforcement activity or enforcement approach can be taken by either members of the Chicago Department of Public Health, the Chicago Police Department, or investigators from BACP. But again, our initial approach is hoping that everyone adheres to the mask mandate. We are looking, this is not something that we wanted to do, but our priority should be the health of Chicago citizens, and that includes your employees and customers.
Next question. For personal trainers, if we only train one client at a time and we are the only two people in the room, can the trainer wear the mask and allow the client to remove theirs?
In indoor settings, both the client and the personal trainer, even on a one-on-one basis, would both have to be wearing a mask. Again, if your training sessions held in an outdoor setting, then both individuals may remove their mask if they choose.
Miguel, can you go a little bit into detail about the enforcement of the mask mandate, specifically for businesses that do not comply?
Again, if you choose to not comply, the city does have the right to issue citations. Those citations can carry a fine of up to $10,000. And as with previous versions of health orders, I'm assuming the majority of our participants today are business operators or business owners or employees of businesses. The city has been issuing one-day emergency closures or closures for longer periods of time for egregious and direct violations of the health orders. That would be the case as well with this current new health order that mandates masks. So if our investigators or the police were to show up and you have a restaurant that's fully packed with people moving around, people not actively eating and drinking, and no one's wearing a mask, whether it be your employees or the customers themselves, you are subject to closure or at minimum citations on the spot. So we would like the business community to continue to step up, as many of you have throughout the past year and a half, to ensure that we can bend the curve and remove the mask mandate once we fall back under the average of 400 cases a day.
Thank you. For offices closed to the public and fully vaccinated, what is the masking recommendation for open office seating where employees are socially distanced?
Again, if the example provided, if there is you are properly socially distanced and your workstations are 6 feet apart and your employees are static, they're not approaching each other, then in that instance, masks can be removed while your employees are socially distanced at their workstations. Again, we do ask, or the health order mandates that if they're moving through common or shared areas where they'll be closer than 6 feet to another individual, that they be masked. So if your employees are getting up to go to the break room, the copy room, restroom, pick up someone from a receptionist area, then they should be masked at that instant.
Can first dances at a wedding occur without a mask?
In indoor settings, they cannot. We are not closing dance floors. I want to reiterate that and point that out. Neither, nor are we stating that you can have like a standing cocktail hour, for example. But the first dances at weddings should not be occurring without a mask if they are being held in indoor settings. Some wedding venues offer a combination where there might be an outdoor setting, a terrace overlooking the skyline, outdoor patio, or an outdoor setting. In those instances, neither the bride or groom or attendees are required to wear a mask in outdoor settings.
Do face shields qualify as a face covering for performers?
For performers, I'd like to reiterate that while performing on stage, if there is no interaction with participants or attendees, if the singer or is not approaching customers or attendees, they would not be required to be wearing a face mask. As with previous iterations of our face covering, a face shield by itself would constitute a face cover for our purposes.
I'm not sure if you know this, Miguel, but what time is the COVID dashboard updated?
I do not know. I can get a definitive answer from you guys or for you guys. I'll reach out to the health department. My guess would be that it's updated around 2 p.m. That is when Dr. Arwadi, our current health commissioner, has been holding her daily press briefing. So, but if you would, whoever asked the question, if you would send it into BACP outreach at cityofchicago.org, we'll get you a definitive answer as to when the dashboard is updated.
As an employee, what can we do if the owner refuses to make the mandate for all employees?
As an employee, as we're all, at the end of the day, we're all citizens of the city of Chicago. You can file a complaint by either calling 311 or using our Shy 311 app and enter a complaint against your place of business. The same applies to you as a citizen. If you're seeing, like, if you go grab dinner today and you see that the restaurant you chose to attend or purchase your meal from it is not adhering to the mask mandate, you are free to enter a complaint. So you can, as an employee, you're able to file a complaint that BACP would then investigate.
For those asking where to find the public health order, it is located on the city's reopening website, which is chicago.gov/reopening. And in the drop-down menu where it says updates, you click on current orders, and it is the first order labeled public health order number 2021-1.
In addition to the reopening website, it's also the last website that's listed here on the bottom if someone wants to search or go directly to it rather than clicking. So
sounds good. What about neck gaiters? Do they qualify as a mask?
Yes, it would be a facial cover that it's made of cloth, so a neck gaiter that is actively covering mouth and nose would qualify as a face cover or mask.
And once again, in an office setting, do we need to social distance in a meeting in a conference room if you are fully vaccinated?
If there is no need to social distance, there is a need to wear a facial cover or a mask. So again, the current health order is not reinstituting social distancing requirements or limits of capacity limits as to how many people can be in a room or a place of business. So there is no need to social distance, but everyone in that meeting should be wearing a mask.
Are there capacity restrictions indoors?
There are not. I'll go back to that slide. So I want to reiterate, we are not instituting capacity restrictions. So there are no restrictions as in the past. We were moving from 25% capacity to 40% to 50 to 75. There are no limits on party sizes. Many of you in our hospitality industry were used to us limiting, like you can have 6 people per table, 10 people per table. None of that is happening at the moment. No social distancing requirements, no limits on hours of operation. Some of you are operated during the pandemic with curfew hours, depending on whether you're an essential business or not. Our hope is to avoid these future, the future re-implementation of these. And again, our hope is that we do not rise over 800 cases a day or that our hospitalization stats rise. If either of those occur, then the city may go back to instituting those. But at the moment, there are no capacity restrictions for indoor settings.
At a private event held at a hotel, is there a requirement to screen them prior to entry, similar to what concerts do?
There is no requirement for you to go through a screening protocol. You still have the option of choosing that on your own. You are able to set your own policies. They can be stricter than this. That's a decision that you have to reach on your own. You can choose to screen people for your own safety if you wish to, but it is not a requirement that the city is placing on you.
Are there any travel restrictions we should be aware of at this time? Are companies looking to host an indoor company gathering with visitors from out of state? What recommendations do you have that ensure, other than ensuring the 72-hour negative test result?
If they are fully vaccinated and they are traveling domestically, that advisory does not require that someone have a negative COVID test within 72 hours of arrival if they're fully vaccinated. So it's going to depend on your guests that you are inviting into the city. If they've informed you that they're fully vaccinated, then they can come into the city without self-quarantining or the need for a negative COVID test. The negative COVID test would apply only if they're unvaccinated and they're coming into the city. And that is an advisory. I would say that for your own wellness and health of your employees, that you would convey that message to potential guests who are coming for a conference.
If residents in a residential building are not complying with wearing a mask, is the building at risk of fines and or emergency closure?
In that case, the building management, property owner, et cetera, would be subject to fines. We would not be issuing a one-day closure to a building that is somebody's residence. We are not looking to evict or displace people from their residences, but the property management would be subject to a fine if residents of the condo buildings or residential buildings are not adhering to the mask mandate.
And we will conclude with this question. If we did not get a chance to answer your question, please feel free, and we actually encourage you to send us an email at bacpoutreach@cityofchicago.org. I will post that email in the chat box. Question is, if we were to file a complaint, do we remain anonymous?
Yes. So you have the option to remain anonymous. It is up to you. You can choose to not be anonymous. But yes, you can call 311. You don't have to give your personal information in order to file a complaint with the city of Chicago. That would be across the board, not just related to violations of the health order. It'd be for anything else if you want to complain about an unlicensed business or anything that you feel might be like consumer fraud or deceptive practice related. You are not required to provide your personal information.
Great, thank you. And once again, this webinar is being recorded and will be made available on our YouTube channel, which is youtube.com/Chicago BACP. And Miguel, do you have any final words for our attendees?
No, my final words would just be that we appreciate the sacrifices that our business community have made over the past year and a half. Again, ever-changing regulations. We appreciate that you've all stepped up and tried your best to move the city out of the pandemic and protect your customers and employees.
Great, thank you, Miguel, and thank you to all of our attendees for joining us today. We wish you a good rest of the day and a good weekend. Thank you so much.